The goal is to maintain patient-centered care, and in and around the patient we provide a service for them. There's social support, psychological, spiritual support, and we all come together to provide that both at home and in here at the hospice facility. Most patients, they'll transition from inpatient hospital setting to a home, or they'll already be home and be referred to the hospice program, and at that time we'll bring in the resources at home to provide them with the level of care they require.
So hospice is very unique. It has 4 different levels of service. We have routine home care, and we'll go over each one of these in detail. Continuous care, general inpatient care, and respite care. In hospice, the benefit is set up to follow the patient and provide services to them based on their unique needs. People really want to be in their home environment. It's what makes them happy. Their family is there, their animals are there, all their stuff is there. And so that would be their routine level of care. And under that, they will have an interdisciplinary team that visits them. That means they'll be assigned a nurse who will make appointments and come out and see the patient in their home, a social worker who will make appointments and come out and take care of the patient at home, a spiritual counselor chaplain who will come out and see them. They're part of the care team, as well as a physician assigned to the case who will oversee the medical care and can make visits. General inpatient level of care, a patient is either in a hospice house freestanding or in a hospital setting, and they get an acute level of care, meaning this person has refractory needs. They're having distressing symptoms that requires intense symptom management. We're going to keep them more on an inpatient setting so that we can monitor them, and the physician's going to make a visit every day to make sure that the medical plan of care is acceptable in meeting the patient's needs. Continuous care is where we can put a nurse in the home for like 8 hours to meet that patient's acute needs. We can be there 8 hours, 16 hours, or 24 hours based on what's ordered and based on what type of treatment we're providing for the patient family. Respite level of care, we provide a 5-day respite for a family, and then hospice places the patient into the nursing home that we have a contract with for 5 days. And those facilities provide room and board, meals, and things like that for the patient, but it gives the family a break to take care of some type of business or even go on a short vacation. I think we give people a gift in a lot of ways because we're their host on this journey, and we help them defragment a very fragmented health system so they can get answers. We empower them to manage their illness instead of being managed by it. And we bring their whole family into the picture so that there can be some cohesiveness with goals and conversations that need to be had instead of people feeling like words weren't said or things were left undone. And I think that brings a lot of peace and reconciliation during a time that can be very scary for people.